Good afternoon. This is Dr. Kevin Lamb, introducing you to our newest young physician here. This is Dr. Drew Chapman. He hails from us from Barry University and trained at Grant in Ohio. So I'll let him introduce himself to you further.
Hi, I'm Drew Chapman. I born and raised in Lake Placid, Florida. I've been recently relocated here to the Naples area, and I'm looking forward to serving the Naples community.
What brought you into the field of podiatry?
So I was looking for a career in something in medicine, and after I shadowed some podiatrists when I was in college, I really enjoyed what they did and saw the fact that you could be a surgeon as well as treat patients in office on a day-to-day basis, and that really seemed like a very rewarding career. So that's the path I chose, and here I am.
Awesome, awesome. What kind of activities do you like to do outside of podiatry and medicine?
So I have a wife and a son that I really enjoy spending time with. I do enjoy the outdoors, hunting and fishing. Also, avid sports fan, and also motorsports racing as well.
Awesome. What kind of conditions you like to see in podiatry? I know we see a lot of things, foot and ankle and the lower leg, but there are certain things that certain doctors tend to gravitate to. They tend to like doing more. Like for me, I like to doing the minimally invasive bunionectomy. I like doing heel pain treatments such as the shockwave therapy and radiofrequency for difficult neuromas. What part of podiatry really that you really like? What niche that you really enjoy?
So I did quite a bit of external fixation when I was doing my training, and I really enjoyed doing that, seeing the different pathologies and surgical conditions that you could be treated with out having to actually put hardware inside the body, but actually doing it through the outside of the body.
Well, external fixation, I know I was trained by Dr. George Vito, excellent guy for learning external fixation. Do you like to use that for, do you like seeing patients with Charcot? Do you like seeing patients with trauma? What type of conditions you normally put these external fixation or what they call cages or rings on?
So that's the beauty of external fixation, is the fact that you can treat any surgical pathology with external fixation. So it's great for trauma. When there's a lot of swelling, you can put this on so you don't have to actually open up the skin. For Charcot, it adds an extra level of stability to, if you do use internal fixation, to actually protect the internal fixation, and that comes off after the healing's complete. I have treated quite a few children in practice. I do like seeing pediatric patients and treating anything from, heel pain to flat feet. Um, I do enjoy just about any aspect of foot and ankle surgery.
Awesome. So external fixation is something that not a lot of podiatrists do. Um, it requires them a little bit more expertise, a little bit more skill set, but I think it really offers us as surgeons more tools in our toolbox to deal with complicated cases. And 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 you've been with me for about what 3 weeks now, and you see kind of pathologies that we deal with. Um, we deal with a lot of pathologies in this area, Naples, Florida alone. So I think having you here along with our practice dealing with complicated cases using external and internal fixation really benefits our patient population here, don't you think?
Absolutely. Because you have that extra tool in your toolbox, like you said, because there's not one size fits all when it comes to surgery, and especially when you get into some of the more complicated reconstructive surgeries. You have to sometimes think outside the box, and external fixation does allow you to do that.
Yeah, I think the main thing I like about external fixation too is like you're able to build the plan as you go rather than you bought the plate or you bought the rod and you really not very flexible in dealing with certain type of deformities. This allows you to correct along the way. You know,
Exactly. And when you're dealing with deformities, a lot of these plates and orthopedic devices are designed for, the masses. And when you have a complex deformity, that foot's not normal or that bone's not normal. So you have to be able to accommodate to the bone, and external fixation allows that.
so customized surgery for you're customizing the device to the patient basically, and you're allowed to correct for things that previously were thought impossible, such as adult recurrent clubfoot deformity or something like Charcot-Marie tooth deformity, etc., where you really have to play and see how the soft tissue responds, over time. You can even adjust this in the office and do the correction in the office, so you're not, let's say, bought it in the operating room. You can actually
Absolutely.
adjust it in the office with wrenches.
Absolutely. And as things change, swelling goes down, things like that, you may see something that, needs some adjustment. And, with being able to access the actual hardware itself outside the body, you can actually make those, some fine tuning adjustments after we've left the operating room.
And the one trend that I tend to notice, I've been here for 10 years now, and the one trend that I still notice, unfortunately, is that some of our patients in Naples are going to places like Fort Myers or Tampa for care. I mean, I think in our practice, we're able to handle anything below the knee for our patients. So why do you think we're still seeing that happening where our patients are going else, are being referred by even our own colleagues with fellow DPMs to other areas? That still boggles my mind.
That's a good question. I think probably the biggest thing is just a lack of education on exactly what we do and what we can do. The field of podiatry has probably changed more leaps and bounds than I think any surgical profession, really, from what graduates 30 years ago were doing to what they're doing now as far as just training goes. So it's a new uh, era in podiatry, and I think it's still taking some time to catch on. So I think that's probably the biggest issue, is just the lack of familiarity with what exactly the new modern foot and ankle surgeon, or podiatrist for that matter, is capable and trained and qualified to do.
Good. So, well, welcome to the practice. You have a very bright future here. Let's know if you have any foot and ankle problems. Dr. Chapman will be out of our East Naples office at the Greeley office. Call us at 239-430-3668, and follow us on social media.
Great. I'm looking forward to it. Thanks for having me.